For people who end up contracting COVID-19, their survival depends on two main things. First, their will to survive, and second, the science and the treatment that the medical teams opt to use. My name is Dr. Masi Korir, and on this week's KTN News Health Watch, we talk to a COVID-19 survivor, the Chief Executive Officer of the Kenya Medical Practitioners and Dentists Council, and the physicians who work round the clock to manage people who contract COVID-19 and end up in their care.
I came out of hospital on the 21st.
Daniel Yumbia, the Chief Executive Officer of the Kenya Medical Practitioners and Dentists Council, is trying to piece together the timelines of his COVID-19 experience as he prepares to narrate to us how he got infected and the thing that saved him from the jaws of a pandemic that spares no one.
You need a strong will to live.
Yumbia was and still is a unique frontline health worker charged with the responsibility of making sure that COVID-19 isolation facilities across the country were prepared and ready to accommodate Kenyans who need admission.
I was psychologically prepared that it was a matter of time because of the exposure that I would definitely get COVID.
His work involves a lot of interactions in hospitals and with healthcare workers.
Also took precautionary measures that washing hands, putting on a mask and sanitizing continuously in my office, having a sanitizer specifically for the volume of paperwork that have been handling. So I knew I'd taken all the precautions to ensure that I do not get undue exposure. But because of the volume of the medical personnel that I interact with, the few visits to health facilities to assess the level of containment for the COVID-19, and also the various meetings that I would attend, including appearing before the National Assembly committees and interactive meetings where strategy meetings would be held to discuss measures of containment of the COVID-19. I knew that at one point I would let my guard off or I would be unduly exposed.
But despite all these precautions, he got the bug. Despite feeling unwell for a week and getting a persistent headache and fluctuating temperature readings, Yumbia did not think that the virus he had expected to strike at some point had finally struck.
I thought it was the usual fatigue because of the work that I normally do. So I was looking forward to the weekend so that I can rest.
That would not come to pass.
Come Saturday, I told my wife that I was feeling a bit tired. Remember, psychologically, I'm prepared to rest on a Saturday. So that weekend, I stayed indoors, and I did move out, and I had service worship on online. But come the Sunday night, I didn't sleep, but I kept that to myself again. So on Monday, I was looking forward to Monday so that Monday I could see my physicians. Then on Monday, I did have a cough, but I was having some slight difficulties in breathing. So I visited my chest physician. I looked at my chest, and he said there was nothing to worry about, only that he recommended that I do a COVID test.
After testing at the hospital, it turned positive and he needed to be admitted in isolation at the earliest possible as contact tracing began.
We also called the office and said that let everybody in the executive administration floor that do a COVID test so that we could take precautions. So besides home, my houseboy and every other person I'd interacted with did their tests. Fortunately, it told my wife who turned positive, and she was also hospitalized. Straight away, she went to hospital.
Yumbia had already made prior arrangements with a city hospital where he would be admitted in the event that he fell sick. He checked in.
I think my wife panicked, and my children panicked as well.
Yumbia was one of the people who contracted COVID-19 at the beginning of the third wave. He counts himself lucky to have lived to tell his story.
From the ones I took care of, we had slightly more mortality. And I have also noted that even the ones who survived, they got more complications. I'm still following up a few who developed pulmonary fibrosis. They survived, looking at the CT severity score. We do CT scans on some of them. They had very severe scores. Those who, few survived. You would look at a scoring of about 24 out of 25. There's one who had a score of 25 out of 25. Most of those patients died, but these ones made it. But they have had a disability where they require oxygen at home. They're now using oxygen concentrators at home.
The first thing they wanted to do was to secure my chest, my lungs. That was their focus. That they wanted to ensure that my lungs would not be infected. So they took those x-rays and other tests were done to confirm the situation of my chest, and then they started their treatment straight away.
Remdesivir was a repurposed antiviral drug. It was meant to treat what was corona SARS-CoV-1 and Middle East respiratory syndrome coronavirus. So then the tests in the laboratory or in vitro test showed a promising effect of this agent against the SARS-CoV-2 or COVID-19.
Yumbia was on oxygen in addition to remdesivir, an antiviral treatment that was initially tried for other coronaviruses and Ebola.
Never lost so many patients, not because of anything, but I think the supportive care over and above the specific antiviral therapy was quite good. So we never lost so many patients because literally all our patients were put on, the ones who were hospitalized were put on remdesivir. So I would say a good experience because we discharged most of our patients home.
Initially, there was a lot of excitement on remdesivir, but some studies were reporting benefit, others were not. So at some point, we went slow on it. There was one that came up towards the end of the peak that was called tocilizumab, the biologic agents, and it was very costly. We even tried it on some of our doctor colleagues who were admitted in the HDU, 1 or 2, and the doctors actually made it. So I think tocilizumab has really shown, at least for the few cases we've tried, been very promising, and we were able to get some of our colleagues out of ICU. Although they did not need intubation. Yeah, we just put them on very high oxygen and we gave them tocilizumab and they did well.
According to the physicians, people admitted in hospital due to COVID-19 will require medical oxygen at the very least, even as other pre-existing conditions such as diabetes and hypertension are managed in addition to the COVID-19.
This disease comes in various spectrum. There are those who get very mild disease. At most, they would not need anything, maybe paracetamol for the muscle pains. Those ones they don't need much. But the challenge has been on the very severe cases who are in the HDU. Those ones, most important thing has been oxygen. That's what we are giving them. At least in the fourth wave, we had a lot of them admitted and they were put on ventilation. The invasive, very few, we decided not to put many of them on invasive ventilation. We are doing what is called non-invasive ventilation, where we are giving very high flow oxygen. That is the mainstay, actually. There was a time, you remember very well, there was a deficiency of oxygen in the whole country, and we really had it rough, Over and above the use of oxygen, we were also giving them steroids. We give them dexamethasone that deals with the inflammation. The other treatment that we were giving these patients was blood thinners.
Dr. Mwita cautions people living with diabetes who contract COVID-19 that upon being started on dexamethasone to manage the COVID-19, the blood sugar levels may need to be controlled on insulin, especially if they were not on insulin before.
Some of them were not even on insulin before, so we had to change them to insulin, and they were not very happy about it after they recovered. People fear insulin, so we had to cancel them and tell them, you see, we were giving you a steroid and your sugar just control went haywire. you have to be on some form of insulin for a while as we monitor you. So that was the challenge with dexamethasone. Control of blood sugar became a problem. But you see, the thing is, we told them, you see, this thing helps you get out of oxygen. So you'd rather get the injection for some time, and at least you're alive.
While doctors work round the clock to fight off the virus and make sure one goes home in sound health, for patients like Yumbia, the psychological toll of the admission can be unbearable.
I would sleep during the day. This is because I was assured of complete surveillance by nurses and doctors. When I was left alone at night, I could not sleep.
Yumbia was eventually discharged home to recover, and so far, he has not had any serious complications after the initial illness, unlike some patients that Dr. Mwita, a physician, has been attending to. He says that the third wave affected more people with pre-existing conditions and the elderly. At the end of the wave, unlike at the beginning, he has more patients dependent on oxygen, even after being discharged from hospital.
I have about 2 or 3 who I'm following up who are still dependent on oxygen, although the requirements are going down gradually. You know, March, April was the peak. That's when we really had very severe cases. So these patients are still on oxygen. So that tells you that this time around, we really had more disability on the few who survived.
Most of the COVID survivors have got a lot of social stigma, that where you go after hospital is the biggest challenge.
Family and psychosocial support to wade through the murky experience of a COVID-19 infection, in addition to the trial of different medicines, be it steroids like dexamethasone or antivirals like remdesivir that are thought to help in managing the disease, are perhaps the main weapon that people who contract the virus have. The unpredictability of the coronavirus infection and the fact that there is no one treatment that would cure this disease makes managing this condition an uphill task for both the patients and the doctors. Dr. Masikorir,